Hi, Littleton, and welcome to our second episode of 01460 on the Go, the podcast about Littleton for Littletonians. Today we're here talking with Fire Chief Steele McCurdy.
How are you?
Hanging in there. How about you?
Doing well.
And as always, our town administrator, Jim Duggan.
Hi, everybody.
We're here to talk about Neshoba Valley Medical Center today, which is an issue that we've been looking at for quite a while now. Just to provide a little background to anybody who maybe hasn't been reading into this quite as much as the folks here on the table. The Neshoba Valley Medical Center closed its doors on August 31st last year after its owner, a for-profit company called Stewart Healthcare, filed for bankruptcy a few months before that. And the state stepped in, found buyers for about 6 of Stewart's hospitals in Massachusetts, but Neshoba Valley and Kearney Hospital in Dorchester closed their doors for good. Neshoba had an emergency room and 38 staffed beds, and it was just a few miles away, of course, on some low-traffic roads from Littleton. So I thought we would talk a little bit first about the role that Neshoba Valley played in our community and how did for our ambulance service in particular.
So Neshoba played a very large role in our community, really, when it came to healthcare access, both from the hospital side, but also for the ongoing outpatient side. So looking at different doctor services, different specialties, Neshoba played a massive role in that. And obviously, preventing healthcare issues is certainly much better than waiting until they're emergent. In particular to the ambulance, it's had a great impact. Our affiliation, which is our license to provide service, was actually through Neshoba. So when we got the notification 30 days prior to closure that we wouldn't have that service anymore, that affiliation, we really needed to scramble in order to make sure that we could continue practicing at the EMS level once that hospital closed. We were very fortunate to have great partners in Emerson who really stepped up and moved along a process that should have been 60 to 90 days. We got it done in 17 or so days, so we were very lucky in that respect. When we look at Neshoba and the catchment of patients from Littleton that went there, it ranged between 30 and 40% of our ambulance trips out of Littleton went to Neshoba Hospital. So all those folks needed to start getting transported to other facilities, whether it's Emerson and Concord, Lowell General, Leominster Hospital, or other facilities. So it certainly increased our time on task. Each medical call got longer, took up more resources, really placed the department in a certain level of stress because of it. Our back-to-back calls are very common, so it really compounded many issues.
Could you explain a little bit what back-to-back calls is?
Sure. Yeah, about 33% of the time, so 30 to 35% of the time. Littleton, when we get one call, another call will occur simultaneously. So it's a very, very common factor in our planning for responses, is that we know about a third of the time that we're going to have resources committed in multiple places in the community.
And so Emerson has been a great partner, but they're farther away. And obviously Route 2 is a trickier place to get through quickly than the back roads. How have our average transport times been impacted?
So the transport times have gone up. There's no doubt about that. So when we look kind of at the fall time frame, we had about a 7-minute average increase in the amount of time, which 7 minutes on each individual trip isn't so bad, but when you multiply that out by the number of trips, all of a sudden that 7 minutes compounds into a much higher number. So we anticipate over the course of a year, it's going to be 9,100, 9,500 minutes, somewhere in there, of additional time spent on task to cover the same call volume that we have previously. one of the challenges we're facing also is that our call volume has gone up, went up 6.5% last year. So you have a few different issues that are really complicating this entire closure.
Is the 6.5% increase? I got a couple of questions. So 6.5 increase, is that industry standard? You know that it typically goes up about that annually. And then the other question I had is, maybe the audience would like to know is how long did it take you to get to Neshoba? I know it's increase of 7 minutes, but what was the foundation? What was that foundation to get to Neshoba?
Sure. So the increase, the industry standard increase, it varies very much by towns and rates of growth in
Okay.
population. So certainly, looking forward, kind of the things that are coming into Littleton in the next few years, we can expect a higher rate of growth. Typically, we look at 2 to 3% as kind of a normal growth. At 6.5% of all the communities in the Neshoba region, we were actually on the low end this year, with the highest town getting 17.3% on their increase. So region-wide, we really had a massive influx of calls. And that, again, another complicating factor to this entire Neshoba piece.
Sure.
So in terms of the additional travel time from Neshoba to Emerson, extremely variable based on where you are in town.
Okay.
But when we look at the geographic center of town, which is the fire station, you were looking at 7 to 8 minutes to get to Neshoba. You were looking at 12 to 14 minutes to get to Emerson. So there was definitely a significant difference. And some of that's just driven by traffic, right? East
Sure.
of here, significantly more traffic. Time of day, huge impact.
And so obviously that has an impact on, as you already touched on, that has an impact on how many folks are out on calls at any given time and how long they're out on calls. But what about the patients? What does that mean for the patients, both in the ambulance and then once they get to the hospital?
So I can tell you that in the ambulance, apart from maybe a longer transport time, the care they're receiving is still absolutely top-notch. We have some of the best paramedics in the state. I will put them up against anybody. You can pick your A team, and I'll put them up against them.
I believe that.
So they're a great group of folks. So everybody's still going to receive a very high level of care. Whether it's 2 in the afternoon, 2 in the morning, whether there's 4 calls going on, whether it's raining, snowing, or hot out, they're going to get great service. And we're fortunate that if we're overcommitted, we do have mutual aid partners who are able to back us up, and we do the same for them. There's very much that redundancy region-wide. So in terms of pre-hospital, going to notice very little difference. Once you get to the hospital, this is where you can start to notice a little bit of a difference. With the additional ambulances going to Emerson out of the Neshoba region or going to Leominster Hospital out of the Neshoba region, it does create backlogs at times, and sometimes they're significant. So that ambulance care may continue even though you're at a hospital for 30, 45 minutes, an hour after you arrive. So you're not staying in the ambulance, but you'll be in a hallway still on the EMS stretcher being cared for by our EMS providers.
And that's something that I didn't understand personally before I got sort of more involved in town goings-on. In the TV shows, the hospital, doctors meet you at the doors and the EMTs disappear, and then off they go, straight into the OR. But that's not how it works, right? Everyone, the EMTs have to stay with the patient until there is a doctor, an intake available. Is that correct?
Correct. So
Yeah.
whether it's a doctor or a nurse, typically it's a nurse that the EMS providers will hand over care to. And at that point, that's the transfer of care, then their role is done. However, when you have a high census at the hospital and a critical patient, our personnel will stay for a few minutes and really help augment the hospital until they're able to get the right resources in place. So it's very much a team environment where we're focused on that problem that medical problem at hand.
And so you're seeing an increase in the amount of time, the average wait time, once you get to the hospital?
Yeah, for sure.
Yeah.
Emerson's had a pretty steady increase. Once we get into cold and flu season, that spiked. And Leominster Hospital, the other most impacted one, has seen a steady increase in that wait time.
And I think I saw you surpassed a 50-minute wait time not too long ago.
Yep, a couple times on the same day, and it's
Wow.
happened a few times since then. And really, that's cold and flu season, or flu and COVID season, I guess we would call it, at this point, has really put a tremendous stress on all the systems, from the hospital system down to the EMS systems. This year's flu season we've seen a lot of really sick people, I guess is how I'll sum that part up.
Okay.
Yeah.
And you've talked a little bit, we talked a lot about things that are quantifiable, like transport times and wait times. But I imagine there's some impacts that aren't quantifiable, that are, that you're feeling and that your team is feeling. Can you talk a little bit more about how all these extra minutes that are getting built into your day or forced into your day are impacting you and your team?
Yeah, so it has an impact on really every aspect of what we do, from training, and it sounds silly to say, well, training and calls are two different things. Training's obviously the preparatory work in order to get ready for calls. So it cuts into that training time, that preparedness time that we need on a regular basis in order to keep people's skills sharp. So it cuts into that. It cuts into the time that folks can spend on maintenance. It cuts into or creates burnout when you're running call to call to call, because now when you would have time to come back, write your reports, make sure that all the paperwork was in line, make sure the equipment's all put back together right, you're taking that out, that time frame out, and replacing it with another call, and kind of going back into the washer of potentially, yep, we were just at the hospital waiting for 50 minutes. Now we're back waiting 50 minutes again, so very quickly those hours or those minutes add up.
So now here you have a situation where you would go to Neshoba beforehand. You'd be looking at a seven minutes there. In all likelihood, there's a pretty quick transition for the patient going in. So then now you're leaving and you're back in service. You get back in the vehicle. You're on your way back and you're back in service. Here now you're impacting. You've got the additional travel time. Then you've got the additional wait time. That doesn't even include people walking into the emergency room, never mind being okay, which is from the community now. So now what we're dealing with is how are you dealing with, is it mutual aid, calling people back, and how has that affected the financial impacts, obviously, but also looking at, I think what Karen was making more reference about the emotional effects that and the impacts that has on your staff.
Yeah, so I think to unpack that, two kind of different issues. The first being the
Right.
financial issue. When we have multiple ambulances who are stacked up at the hospital, we're then having to call back people because we, clearly don't want to leave the town with no coverage at all. Our instances of back-to-back calls, it would be a poor decision to not get folks back into the station. So it impacts us in terms of that overtime rate, bringing people in to ensure that we can continue to provide service to the community. And while we only have 2 ambulances, and those may be dedicated, we'll bring in ambulances from other locations, but sometimes they're extremely delayed because they've been kind of in that queue at the hospital. So there may be a significant wait time for the ambulance to get there. But our personnel that come back are able to provide service, provide care. All of our vehicles are able to provide at least basic support for folks. In terms of filling of regular overtime shifts, we need to fill them because when we run too light, Inevitably, what occurs is that we end up not having the resources to deal with kind of our normal day-to-day activities that 6 months ago, we would have handled no problem because we would have been bringing folks to Neshoba, getting back in service quickly. So it puts a huge amount of stress on, and this all adds up in people's minds, right? Trying to get folks to the hospital, get them the appropriate care, get back into town, back into service. And certainly there's times where, because of that shorter staffing, that people are exposed to quite serious incidents. And we see those on a very, very regular basis in the community. Most notably 495. Some not so good things happen out there.
Right.
I don't think anybody in town has not been impacted by something occurring on 495. And,
Right.
you know, sometimes people just need a couple minutes after a call to decompress.
Yeah.
And unfortunately, we've kind of got into this situation where they may not get that time. They may be off to the next serious call.
Yep.
So the burnout over time is a real serious concern. Myself and the deputy, you know, we do the best we can to make sure that we have the resources in place in order to support our personnel, their well-being, and make sure that we're kind of curbing the burnout as best as possible.
Right, and you're using that with professional services to be able to help out in that way.
Yep,
Yeah.
absolutely.
And
And sometimes it's as simple as just, you know, sitting on the bumper of the truck with somebody and talking.
Yeah.
You know, professional services is something we do for the really, truly serious calls.
Yeah.
But sometimes it's just,
Yeah.
you know, hey, how's it going? How you hanging in there? And, you know, just getting a feel for where everybody is. It's extremely important to the overall success of our organization.
It's impressive.
So switching gears a little bit, we've all been in the thick of budget season the last couple weeks. And you've talked about overtime and all the extra hours that you and your team have had to put in. How is that impacting our budget? Maybe this is a little bit more of a question for Jim in terms of the overall budget, or whoever wants to speak to that, please.
Yeah, I mean, and I know, Chief, that you're, what was already allocated for the budget, and you can speak to that expenditure level, but we recognize that this is a very serious financial thing that we check the budget every single day on it, and with Ryan Ferreira and myself, we absolutely, along with the chief, to see what level, what kind of spending did we do just yesterday. Every single day we do that, and but overall for this, and we entrust the chief because we know this is not being done frivolously at all. We are dealing with a situation where lives matter, and we will do the best we can to make sure that we continue to provide the financial resources to the fire department that is necessary. And through the select board's support, wholeheartedly, you have all have expressed to me that you know, this was thrust upon us really within a very short time frame. It's not like we had a couple years to plan for it, and
In mid-cycle.
exactly.
Right, after the budget was all worked out, after we knew where we were. and
Right.
Had everything balanced, and we're in the middle of working our way through that budget.
Yeah.
You know, boom.
Exactly. No, spot on. And so it's, but we will continue to the chief and I talk every day, and we'll continue to monitor and provide the support that he needs. So, but overall, the impact, you may want to speak to that, Chief.
Yeah, I mean, you know, the board, Jim, Ryan have been really great and supportive. Obviously, yes, it happened mid-cycle, but I was still, after returning to town, still just getting my feet under me again in Littleton, learning about the budget we had, where our strengths and weaknesses were within that budget. So certainly it did create a serious curveball. And to Jim's point, we talked about it, figured out a good strategy, how we can deal with it. And you know, we've, I think, done a really good job of balancing spending with making sure that we're able to provide that level of service to the community. You know, even though we have all these many factors that we've already talked about kind of snowballing on us, I think that we're actively managing our resources to combat this issue. So, yeah, I mean, at the same time, we're filling open positions. So we had numerous open positions coming into the August timeframe. So since June, we've had 8 vacant positions that we've had to fill. So a lot of moving parts all happening simultaneously.
Yeah, and it's, you've done a great job managing that, without a doubt. And
Thank you.
the overtime budget that was budgeted for last July 1st is already spent, and that's supposed to last us the entire year. So we'll absolutely continue. Just one thing that, as Karen and I were talking over the past couple days, and Karen brought up the point that, so much of this, it's also affecting, you got dispatchers, you've got the police, they're also first responders, but you also have the dispatchers that are on the other line that, as I think, Karen, you told me that, when people pick up and they dial 911, they're the most vulnerable position they're going to be in their entire life, and they're very emotional. And to be on the receiving end of that, as much as there is training, and we appreciate that, but for one after another, that, there's kind of a ripple effect here with public safety. Yeah.
Absolutely, and, actively work with Chief Bernard to make sure that we're,
Right.
Yep.
Making sure the services are in place, not just for the fire department team, but for everybody in the emergency response side of government, if you will.
Yeah.
Whether it's a dispatcher, police officer, or firefighter, that everybody has those resources available at their fingertips, and we try to be very, very aggressive with that.
So we've talked a lot about the problem, and you've talked a lot about the solutions and the things that you're doing to manage the problem right now. But you've also been really, you and Jim both have been very involved with the state at trying to get this addressed at the regional level, getting
Yes.
something, a long-term fix, if you will. Can you talk a little bit more about that?
Yeah, so we've been involved since the beginning of October in a state task force that was appointed by the governor's office to look at the Neshoba region and the best solutions for healthcare in this region. So that has been a very regular meeting. On that meeting, you have people from Department of Public Health, you have folks from various hospitals, you have state senators and reps. You have folks from the federal delegation that are often involved in it. So really a big group of folks that are involved in looking at different aspects of healthcare in our region. Anything from outpatient services to inpatient services to transportation services for folks. So really taking a big look. That process, when you're involving so many people, moves a little bit slowly at times. I don't think anybody on that task force will argue that point. So the fire chiefs are all experiencing the same issue, which is running into shortfalls of their budget. So we're not alone in having an overtime budget that's spent and kind of overexpending those, our overall budgets. So the fire chiefs, along with the town managers, town administrators, and the state delegation, drafted a letter to the governor asking for financial assistance for the communities for 2 fiscal years, which will give time for the other process to play through, which has luckily yielded UMass announcing that they will be opening a satellite emergency facility. But that's 24 to 30 months away. So we need to be able to certainly get to that. We need to bridge that gap that exists there. So we're actively working with the state. Jim and I went to the Senate Ways and Means Chairman just yesterday. We had a very productive conversation about how the state can best support the local communities and specifically the EMS in these regions, because, again, we're overtaxed, underfunded for what we're attempting to do now, and really, many of the communities are in the same position of not having deep coffers to kind of cover this, so state assistance is certainly needed.
How did you feel that meeting went? What do you foresee as the next steps coming out of that meeting?
So in terms of the next steps, I think it'll probably be with the governor's office directly. I can't say for sure where the next one will be, but we certainly are going to have an open line of communication with the Senate Ways and Means office. That was very clear that there would be some follow-up conversations. The governor's office, who I talk to at least once a week, has also expressed an interest in making sure that we maintain that open line of communication to solve the whole regional issue.
You touched on this briefly. Can you talk a little bit more about, there was an announcement about a new hospital being planned, and that's UMass, right?
Yep.
But not certainly, definitely not, I think they said at this point, definitely not where Neshoba Valley was, but somewhere in the Neshoba region. Have they talked at all in detail about how many beds or what type of services would be included, or that they are planning to include at this point?
Yeah, so in terms of whether it'll be at the Neshoba site, sort of depends on the day.
I see.
Yeah, I think
It's in
anything is
flux.
possible. It's in flux, is definitely the way to put it.
Okay.
I think that's still somewhat up for a little bit further discussion on levels that Jim and I probably will not be involved with. Those are different entities involved in that. So in terms of what they're looking at a location, and a location still yet to be identified. A group of fire chiefs are working with UMass, to try to best identify parcels of land that could be used for the satellite emergency facility. So a satellite emergency facility is not necessarily a full-fledged hospital. So, and this is one of the things that very quickly we see folks saying, like, oh, well, they're opening a hospital. It's not really a hospital. However, a satellite emergency facility can do everything that a normal emergency room or emergency department can do at our local hospitals. So you'll get the same level of care at a satellite emergency facility as if you were to go to Emerson or Leominster or Lowell General. It's on a smaller scale, and what they don't have is the ability to then admit the folks to that facility. So if you need to be admitted to, we'll just say, an ICU, you'll get transferred to another hospital. It could be UMass in Worcester, it could be Emerson in Concord. That's really up to the medical team and matching the needs of the patient with the facilities that have availability. So the way I typically explain it is that if it's less than 20 hours of care that you need, they can take care of that. They do have the ability to hold, or will have the ability to hold people for a little while. And I don't want to say that, well, if it's only 5 hours that you won't get transferred out, it's really going to be dependent upon the seriousness of the illness or injury. But again, I think everybody should be assured that if you're taken to that facility in an ambulance, you're going to get the same level of care as a regular full-size hospital. And that's a very important message that has to get out, because some folks were equating the new satellite emergency facility with something like an urgent care.
Yeah, I've heard that as well.
Yeah, very different scopes, very, very different scopes. So that's certainly some important information for folks to understand. But as it sits right now, and everything is up to change, it will be a satellite emergency facility. My personal hope is that the satellite emergency facility grows over time into a full a full-fledged hospital. But that's not going to happen overnight. That's going to be something that is a multi-year process of evaluating the needs of the region, seeing what the acuity of the patients are that are coming through their doors in order to grow the services like that.
I would think if UMass has that in mind, that would also lend itself to perhaps a slightly longer site search as well. It's the smaller the footprint, right, the more options you would have available. But if the idea is that they're going to plan for growth, then that would take a little bit more time to find the right location for, I would assume.
Yeah, absolutely, and that's why you have a group of fire chiefs working with UMass directly in order to help identify the best locations. The site does need to be big for that reason, but then also there'll be a helipad on site as well. So somebody who has truly life-threatening illness or injuries that needs to be in Worcester or Boston right now, they'll be able to get a helicopter right to their doors, get that individual transferred into a helicopter and at a full-size trauma center or cath center for a heart attack within minutes.
Did Neshoba Valley have a helipad?
Yep, it was right out in front of the building. Yep. Hidden in
Learn
plain
something
sight.
new every day.
A couple other things. It's Chief, you may want to be able to speak to it being a recent event, but we're dealing with 13 communities here, and the overall, looking at the amount of population there it's affecting a lot of people. One thing that I continue to every once in a while forget is we're also dealing with the correctional system. They have people that also have to frequent the area hospitals now that are now potentially taken away from Neshoba. So they're also stacking up and dealing with that situation at other area hospitals. And the chief the other day was talking in Leominster. They had a multiple alarm fire in which how many communities responded? Do you remember that?
So I don't remember the number of communities. It was a 4-alarm fire in a commercial factory. But when that happens, it certainly creates a whole different stressor to the entire region, because now a lot of the people who work on the ambulance also cross-staff onto the fire side. Everything is cross-staffing in all of these smaller departments. So you're taking your first line of folks and they may be committed to another community, a fire or anything, could be a hazardous materials incident in another community. None of the departments, even the city of Leominster, have the resources to deal with these major incidents alone. So that's where our mutual aid system becomes important. We have in Massachusetts a very robust mutual aid system that if you have an entire area that gets completely depleted, we can move resources across the state in order to make sure that we have folks able to respond to additional emergencies or augment the folks that might have been working for the last 10, 12, 14, 20 hours on a specific incident. The chief and I will go, as you talked about the meeting yesterday with the chair of the Ways and Means and that meeting. We're very we're fortunate that with all the support that we've had with the select board has been steered by the select board. Our state delegation, Senator Eldridge was there with us yesterday, and I know that Representative Arciero was supportive of it, and Senator Cronin was there yesterday, and he's out of the Fitchburg area, Leominster area, and so there is a lot of attention and a lot of conversations going on and on the impact on this. And there's an upcoming meeting and I will applaud Chief McCurdy this because of the relationship he has built with the governor's office of coming up with administration and finance. That meeting is going to be scheduled, and that is something that's identifying the funding source for areas to be able to help the 13 communities in an equitable way to make up for, give them the flexibility whether they need to hire new personnel
to fill open slots because they just haven't been able to work that into their budget, or we are at full complement but looking at making sure that we have the resources there to be able to give those people the relief, the first responders, and calling people back and as manage that really very well as the chief and the deputy chief do. Yeah.
And for me, I think we've covered a lot of territory. Is there anything else you'd want to add to the discussion for residents to know or to look ahead to? Or
Yeah, I think that, my big message is, I know we talked a lot of, I don't want to say it was negative about the impact, but rest assured that the EMS and hospitals continue to operate at a very high level.
yes,
Have there been impacts? Absolutely, but it should not dissuade somebody from calling 911 if they need help. And if you're having any sort of symptoms of a potential medical emergency, make sure you deal with those proactive. And that's something that I always try to get folks to look at, even before Neshoba was closed, is, make sure you take care of yourself. Make sure that that you're getting to your doctor on a regular basis. And if you have any questions, that's what they're there for. You can call your doctor's office for sure.
thanks.
Fantastic.
You can keep an eye on our newsletter in the future for more updates, and of course, we'd love to have you back when there's more to talk about and more progress on the budget front and on the hospital front. We'd love to have you back for more updates. But thank you for coming very much.
Well, you can read the fire department part of the newsletter coming up, and that might be the basis for the next discussion. So
Perfect.
I'm not going to give it away here. You got to read the newsletter to find out what I'm talking about.
That sounds like a plan.
All right. Well, thanks, everybody. Appreciate you listening in. Hope that you'll let your fellow residents and friends and family know about this podcast. We hope to make it a regular feature, probably maybe every other week that will be coming out. We're still working on the cadence, but please spread the word, and we will be talking with you again soon.
In the meantime, if anyone has any questions about anything, please, you can reach me on my cell phone at 978-621-9655.
And you can reach the select board at selectboard@littletonma.org.
Great.
Thanks, everyone.
Thank you. Goodbye.